therapy bills that are so important for Florida and Florida's children. He will also discuss what's ahead for Florida as a result of the new fluoridation law. And Dr. Frank, I would be remiss if I didn't say that Kathy Wynn expressly asked me to ask you to address whether you have a plan for a plan of action regarding the fluoridation that will impact our children. Dr. Catalanotto is the founder and president of Floridians for Dental Access. He is the former dean and current professor emeritus in the Department of Community Dentistry at the University of Florida. His achievements include initiating the UF statewide network for community health to provide educational service opportunities for dental students. He also increased access to oral health for underserved patients. Dr. Catalanotto, the work that you do with such energy and such zeal is so important, and we thank you so much for sharing your time with us tonight. Thank you.
Thank you very much, Joan. I appreciate the introduction. It's good to be with you all. I'm going to go off script immediately, and I want to read a very short email I got literally about 3 minutes before your meeting started from a patient who saw our website and wrote to us. Help, I just came from dentist yesterday. Very bad bacterial infection throughout my mouth. He pulled one tooth. I'm on Medicare and Medicaid. My insurance barely paid for anything. I'm on disability and only get $7,000 yearly. I need help to find a dentist or origin that can help me. Doctor told me the infection has killed people before. Please. So that's what we face every day in this state. We are not the sunshine state for a lot of people. We are really the toothache state. I'm not going to give you lots of data, but I want to sort of give you an overview of how bad the problem is in Florida and then what we're trying to do about it. So hold on 1 second. Now all of a sudden my slides are not moving. Let me put them back on. Sorry, they worked just a minute ago. Oh, there we go. Okay, so how bad is the dental access problem in our state? So by all the measures that we can find and get hard data, we are about the worst state in the country in terms of dental access. 65 of our 67 counties, the federal government declares as a dental health professional shortage area. And there are 7.1 million people living in those areas in our state. We lead the country in the number of people that use hospital emergency rooms to get their dental care, and I have a slide about that in a minute. But for children, more children visit hospital emergency rooms in our state than in any other state. We also rank last in the percentage of children who get to see a dentist at least once a year. That's not just kids on Medicaid, that is all children in our state rank last in the country for children. We rank 42nd for adults who have had a dental visit. And this is 2021 data. So why is this important? And this is relatively new science, and by that I mean science over the last 20 years or so. Very clear relationship between poor oral health in children. It's usually cavities, and that impacts school performance. Lots of papers showing that kids with pain from dental infections in their teeth have poor school performance. In adults, it's more serious in that it's linked to management of diabetes, it's linked to cardiovascular disease, and it's linked to poor birth outcomes. And that is a very significant problem in terms of premature births and the associated costs and other negative medical factors that are associated with that. You may have heard about the James Madison Institute. I'll say this again later, but we are a bipartisan organization. We have support from organizations on the left. We have organizations on the right that support us. One of our partners is James Madison Institute. And they literally about 7 days ago released this poll results. They did a scientific poll of a portion of Floridians. 1 in 5 people in Florida reported difficulties scheduling dental appointments. 1 in 4 have issues with dentists not accepting their insurance. And we're not just talking about Medicaid here. We're talking about other insurance plans. Some dentists don't accept insurance. They just want cash on the line. And 26% securing a timely appointment. It's just hard to get dental appointments. I was on a board meeting on Monday night. One of my professional colleagues, a faculty member at the University of Florida, was sharing with the group. We were talking about access for the clinic we operate in the county. If she were to cancel her appointment this week, it would be 3 months for her to get an appointment at her dentist's office. This is just crazy. So I heard you use the term equity before. We use it in this sense that oral health is an inequity issue. Who is most affected by this? Clearly and obviously low-income families, communities of color, elders, immigrant populations, and especially those with developmental disabilities and other special healthcare needs. They have a very difficult time finding dental care for their family members who have developmental disabilities. What's the reason? Why can't people access care? The number one reason, quoted by all the authorities, is cost. Some people might guess that it was fear of the dentist. No, the number one reason is cost. And for the low-income groups that are on Medicaid, only 18% of Florida dentists accept Medicaid. And that could be just one patient. So we really only count dentists who see at least 100 patients on Medicaid in a year. And that's only about 11% of Florida dentists take patients who are on Medicaid. Let's look at hospital emergency room visits. This is 2021 data. I'm waiting now for the 23 data, which I will get somewhere in the next month or so. But look at the middle number first, 116,000 visits to hospital emergency rooms for preventable dental conditions. Why do patients go there? Because by law, the hospital must see them and must provide some treatment or service. All right. 3,100 admissions to the hospital because the dental infection was life-threatening. How much did hospitals bill out for that? $547 million, over $500 million. Most of this is Medicaid or self-pay. You know what self-pay means? Self-pay means nobody pays. It means you and I pay because the hospital is going to need to increase their rates when they see us who have insurance so they can take care of these uninsured patients. When you look at patient surveys, dental care is the number one unmet healthcare need in our state. So let's look at your county, all right? We have access to this data. You had, in Broward County, over 7,000 hospital emergency room visits your hospital's billing out $21 million. I should also let you know that the only thing that happens in most hospitals are antibiotics and pain medication. And then they're told to go see a dentist tomorrow. Well, if they couldn't find a dentist that would take care of them today, the day they went to the emergency room, they're not going to find a dentist tomorrow. So that means we also lead the nation in what we call frequent flyers, repeat visitors, by definition, 4 times in 1 year for the same problem. We lead the nation in repeat visitors for dental problems in our state that going to hospital emergency rooms. The other number we look at is Medicaid utilization, the percentage of children on Medicaid who have at least one dental visit in a year. So actually, let's start from the bottom up. If you look at the national number, nationally, we're not doing too well. Only 43%, 43.7%. Florida, again, ranking at the bottom of the country at 36% of Medicaid kids. That means that several million children did not have a dental visit in the Medicaid population. But if you look at Fort Lauderdale, you're not horrible compared to the national numbers, and we have this by metro area. We don't have it necessarily by county, but you're still lower than the national average in terms of the percentage of children in the county who receive dental services. So there are lots of solutions to addressing this problem, all right? But when you understand that Florida is short 1,500 dentists, the existing dental schools are only producing about 400 graduates a year. The state is continuing to grow. We're not the fastest growing state, but we're one of the fastest growing states. You're never going to catch up in terms of having enough dentists. And so dental therapists are a solution that have been used internationally, and I'll talk about that in a minute, and have been used by a number of other states across the country. So first of all, what are dental therapists? And the best analogy I can think of to share with you is, I'm sure when you go to your physician's office, I mean, in particular, a specialist office, you're going to very likely see a PA or a physician's assistant. That's the best analogy I can think of to a dental therapist. They can do a limited number of procedures that you might need for your dental care. They must work under the supervision of a dentist. So that's why we use that first term, oral health professionals working on a team with dentists and hygienists under the supervision of a licensed dentist. And they provide what we call evaluative care, preventive care, restorative care, and even minor surgical procedures. They can take out baby teeth, and they can take out very mobile permanent teeth. And there's actually a classification system, and there must be at least a +3 mobility for that to happen. Dental therapists have been in use across the world for over 100 years in over 50 countries and 20 years in the United States. And the first place that they were utilized was in Alaska. That's when I heard about them. And I called the organization that was working and implemented this. And they flew me up to Alaska, and I spent a week watching what they were doing. And I was there for the last week of their first year. Hold on, my apologies, my phone. And this has now been adopted by 14 states and some other tribal authorities. Dental therapy educational programs are accredited by the Commission on Dental Accreditation. That's the same body that accredits dental schools. So, and that's sort of what I like to call the good housekeeping seal of approval on these educational programs. That assures the quality and safety of the program. Dental therapists have to take a clinical licensure exam just as dentists do. The difference is that it's limited to only those procedures that are in the scope of their practice. So I, as a dentist, have the legal ability and right and the training to do about 400 procedures. They have about 80 procedures in their scope of practice. More importantly, in last year's clinical examination, dental therapy students, you take this exam near the end of your educational period, so when you're usually in your senior year or last year of education, dental therapy students actually had a higher pass rate than dental students did. And I know that sounds hard to believe, but the reason is they have this limited scope of procedures. They do more of them, both in school and then when they get out into practice. Again, they're accredited by the Commission on Dental Education, dental accreditation, and they have a very limited scope of practice. And our design of our dental therapy legislation is just like it is in the other 14 states where they have passed it. They must be employed by a Florida licensed dentist, and they must be supervised by that Florida licensed dentist. So what are the kinds of things that they can do? They can take x-rays and interpret those x-rays. They can do examinations. They can do something we call treatment planning, planning out your course of treatment. They can refer to specialists if they need to. They can do all the preventive procedures that you might get in your office from a dental hygienist. They can place fillings. They can place what we call preformed or stainless steel crowns. They can extract primary teeth. They can extract permanent teeth that have this +3 mobility factor. That means they can wiggle 3 millimeters in either direction. And they can dispense and administer medications, and they can provide local anesthesia. So that's their limited scope of practice. They do not do dentures. They do not do implants. They do not do root canal therapy. They do not do periodontal surgery, procedures like that that are more complex. Single tooth restorations are the best way to define and understand what they can do. So where are we seeing that they are working across the country in these other 14 states? They can work in private dental offices. They can work in federally qualified community health centers. They can work in other safety net kinds of organizations like philanthropic clinics. Minnesota, they've got some actually working in hospital emergency rooms. Here's where their big value is, though, when I get to schools and nursing homes. So they work under the concept that we call general supervision. That means they must be hired by a dentist. They must have a collaborative practice management agreement with that dentist, but they can now work outside of the office in a school, in a nursing home. Okay. And very typical of how they might work, there's an organization called Children's Dental Services in Minnesota that now employs 10 dental therapists. On Monday morning, they pack up their equipment in a van. They go set up in a school. They take care of children every day. Think of the advantages of that. Mom or dad doesn't have to take off from their hourly job at Walmart to take the kid to the dentist because the school nurse has gotten the permission slip. There's no failure rate. There's no empty chairs because if that child is out sick that day, there's another child in that classroom waiting for dental care. They go to nursing homes and deal with frail elderly patients and patients who have disabilities. So they expand the scope of where services can be delivered. Don't make the patient go to the office. Bring the therapist to the patient. Now, are they the answer to solving the access problem in Florida? No, of course not. There's a whole bunch of other solutions that are out there, improving the oral health literacy of the public, and in particular policymakers, making them understand that relationship I mentioned to you earlier about the relationship, for example, to diabetes. poor birth outcomes. Something called medical dental integration. We've got a number of organizations now in Florida, particularly FQHCs, where a dental hygienist is placed in the medical clinic, able to provide care alongside of the physicians and the PAs and the RMPs that are providing care. We need more safety net programs, but they have major problems trying to hire dentists. We need to improve our Medicaid system in our state. We have a very problematic Medicaid system with low reimbursement, very, very cumbersome to deal with. We need to get dentists to go to underserved rural areas, and we use loan forgiveness programs to do that. But loan forgiveness programs are very expensive, and the literature says that they only have a short-term impact during that loan forgiveness period. And then when that's over, usually the dentist wants to leave that area. And there we are up in the top center. We're one of the workforce solutions. We think dental therapy is a great way to expand access in Florida. Their education is 3 years. After high school, there are usually about a year of college level prerequisites. We envision that most of the training programs in Florida are going to be in our state colleges, which have an existing dental hygiene educational program.
Yeah.
And it's going to be relatively straightforward and relatively, and I use that term relatively, inexpensive to get these programs started. We're having conversations with a number of state colleges that are interested in doing this. So what's the problem? This is one of the slides from my communications team, which captures the essence of the problem. There's only one organization that opposes dental therapy in the state of Florida, and that's the Florida Dental Association, along with the American Dental Association nationally, but specifically in Florida, the Florida Dental Association. I have to sit and listen at legislative hearings to all the misinformation that they claim and state. I can look any one of you in the eye, although I'm looking at you through this computer screen, and say they are just lying. They are misrepresenting facts. They are reporting myths about dental therapy and how well it works and how safe dental therapists are. But that doesn't stop them from telling committees in our state legislature and telling individual legislators untruths about the safety, quality, cost effectiveness of care provided by dental therapists. And if you want the facts, you can go to that organization, or you can go to our organization, Floridians for Dental Access, and we can share with you the facts. And I did not want to spend a lot of time going over that today. But I want to give you an example of one of the tools and one of the things that they do. They have a toolkit to fight dental therapy. This happens to be one by the Academy of General Dentistry, but the American Dental Association has a very similar toolkit. And I have to tell you before I show you the next slide that this is embarrassing for me as a dentist, as a professional, to see that my colleagues are actually suggesting to lie and mislead legislators. This is from one of the pages in the toolkit. And I first want you to look at that middle sentence, not the one that's highlighted in yellow. For them, and the upper paragraph, they know the literature now says that dental therapists are safe and provide high quality care. But they suggest their members to still talk about, particularly one-on-one with legislators, would you be comfortable with an individual with just 3 years of training carrying out an irreversible surgical procedure using a 500,000 revolution handpiece on your grandchild? Now remember, they know the literature says that they are safe, but they directly try to mislead legislators with emotional, charged words, things like irreversible surgical procedures. I'm sorry, that's a filling on a tooth. That's the extraction of a decayed baby tooth. That's a procedure called a pulpotomy in a tooth. Procedures that they are certified to be safe and of high quality. And this is what we have to deal with. One of the complaints that they'll make is that dental therapy will create a two-tiered system of care. The real dentist for most people and the dental therapist for those poor people. Baloney. We already have a two-tier system of care in this country. Those who can access care and those who can't. They're very proud of their missions of mercy, free dental clinics that they sponsor across the state, where patients, you may not believe this, but it's true, patients have to wait online 24 hours to get 1 or 2 procedures done the next day at the mission of mercy. This is not a healthcare system. Philanthropy is not a healthcare system. I admire folks who offer to volunteer at those programs, but that is not a system of quality healthcare. And again, I want to emphasize this. So there's been a review of the international literature on dental therapy. It's about 1,100 papers. They've been in the United States for about 20 years, and there's approximately 120 papers that evaluate their quality. The data is unequivocal. High quality, safe, cost-effective, and improve access to care. Let me give you one example. Malpractice insurance for a dentist can be $2,000 to $4,000 a year. For a dental therapist in other states, it's $100 a year. These companies are not stupid, these malpractice insurance companies. They know that the procedures that dental therapists do are low risk. So here's an example, the states where it has been approved and is up, running and working. In many of those states, not all of them. It takes a while to get the educational programs going, but that is happening. We don't think we're going to have that problem in Florida because we've already got a number of programs identified. As soon as the legislation passes, they will apply for their accreditation status by the Commission on Dental Accreditation. So what I want to share with you is where we are right now with this legislation. So I've been at this for 9 years. I'm very persistent and patient. It's taken other states 9 to 10 years to get this passed. Some other states have been luckier. It can be done in 2 or 3 years. But in 24, we successfully passed our legislation in 2 House subcommittees. This is good. Never made it through the full House. Things got lost in whatever else happens up in Tallahassee. However, in 25, we passed committees again. It was House Bill 21. And then we passed the full House by a vote of about 88 to 21. Some bipartisan support. The organizations that support us are bipartisan, both, again, right and left. But we're a Republican majority state. The Speaker of the House, Danny Perez, was the original bill sponsor for dental therapy 8 or 9 years ago. He wants to see this done, and we got great support in the House. We're having issues in the Senate, and so when the Rural Renaissance bill from the Senate came over to the House, what the House did was cut it up into 2 or 3 pieces. One piece was focusing on healthcare, and they attached our dental therapy legislation to that. It passed the House with roughly the same vote, as I mentioned earlier, went back to the Senate, and that's when it got kicked back and forth. Literally until about 7 p.m. on Friday night of the last day, when it just did not go forward anymore in the Senate. One of the reasons for our success is that our coalition continues to grow. We have actually, that number is now closer to 600. I didn't check with my staff today to see exactly where we are, but the last time it was just under 600 organizations and individuals, including about 25 or 30 dentists who are supporting our efforts to bring dental therapy into our state. We also, and the League of Women Voters has been one of our supporters. We get some pretty good funding from organizations like CareQuest and Delta Dental, which allows us to put on, and in particular the last 2 years, ramp up our communications campaign. And you should also know that there's a lot of national interest. A lot of people are following what we're doing in Florida. Why? We are such a big state. Once Florida passes dental therapy, those 14 states are going to rapidly increase. Because Florida, California is just starting their effort to get dental therapy going. When a big state goes, the rest of the country is going to follow through on that. Why are we succeeding? We have a very strong public education campaign. 3 years ago, our efforts were joined with the American Children's Campaign. That's a long-term statewide advocacy group that focuses on children's issues. And they became our major partner in this. They have expertise in both the politics and in communication. And so we have done as much of these kinds of meetings, talking to small groups like yours tonight, that I can do. Plus our mailing, and I'll talk to you about that in a minute. When we got started with American Children's Campaign, we did some poll testing of what the messages were that sell on this issue of, in helping people understand the access crisis and then the potential role of dental therapists. And I'm really happy to say that this is another spot where we saw bipartisan support for this. Traditionally, this would have been a liberal, democratic, progressive agenda item. It's not, and it's not in our state. It gets good support from Republicans. It gets good support from Democrats. And again, as I said, here we are in a Republican majority state, and we've got overwhelming votes in the House. What we're doing with dental therapy is trying to what we call systemic change in the system. All right. There are not enough providers. We need to do what medicine has done. We need to bring in new providers that work within the system. ARNPs and PAs work for physicians. Dental therapists are going to work for dentists, but it's producing a systemic change. And that is very appealing to policymakers, and it's very appealing to the donors and funders that support our work. We also do a lot to elevate the voices of those most affected. And so we collect patient stories as much as we can. And I'll have a link for that at the end of the presentation. If any of you have stories that you'd like to share about difficult access issues. The other thing is I am a supporter of Medicaid expansion, but Medicaid expansion has, as we say in this last bullet, has been caught up in the culture wars that are going on in our state and across the country. Dental therapy is not caught up in these culture wars. Again, we have bipartisan, but when you have the Florida Policy Institute, a liberal progressive organization, and the James Madison Institute, a conservative free market organization, write a joint op-ed together to support dental therapy, that should tell you something about this. And let me tell you why that occurs. So the Florida Policy Institute is interested in equity and improving access. That's why they support this. The James Madison Institute believes that more dental providers will create competition in the market as it improves access to care. And competition from an economic science perspective lowers costs and increases quality. This is the fact of life in the business community and in economic science. So two different organizations with two different agendas merge in terms of supporting dental therapy. So why are we encouraged about next year? And to be honest with you, next year for us starts this summer.
Yeah.
We've been debriefing what happened over the last 10 days. We're having a big leadership team meeting next week, making our plans for what we're going to do next year. So the House has clearly shown their support for this and that they're going to continue to support the work that we're doing. Our coalition is growing, and I'm going to ask you as individuals or as a chapter to join us so that you will get our mailings, but we can point to the Broward County League of Women Voters as an individual organization. Your statewide organization are supporting, but we want individual county organizations to join. And we've got momentum on our side. Plus, and this is most important, we have the facts, we have the data on our side. So our plan is to start working this summer, meeting every senator in their home district office, taking with us maybe a patient who's had a problem, an organization that's in that county that support our issues. Most likely that's going to be the federally qualified community health centers, or maybe it's going to be the colleges that are supporting our efforts. And we're preparing a new fact sheet, probably a couple of pages instead of the traditional one-pager. And we're going to meet with every senator before committee hearings start. This year, they're going to start in September. And make sure we've spoken to everybody so we are ready to get this done and bring this to closure this legislative session. This is just a sampling of some of the institutional members. I hope you'll recognize some of them on there and who they are. As I said, we're closer to 600 now on this slide. Individuals, organizations, including a lot of dentists and a lot of dental hygienists. And our network reflects the diversity of the state. And I think it's also important to recognize that. So you'll see, for example, the Jacksonville Urban League, an organization representing the Black community in Jacksonville. All right, so that's it for dental therapy. So I was also asked to talk a little bit about community water fluoridation. All right. So let me give you some facts. Now, I am not an expert in community water fluoridation, but here is where I follow the lead on the Florida Dental Association, the American Dental Association. I'm a pediatric dentist by training. I work in a public health department. And so I sort of know what the facts are. Community water fluoridation is absolutely safe when water is at the right fluoride level, when it is added to be 0.7 parts per million. Very, very small amount. Okay. It is the most inexpensive way that we can get wide-scale use of fluoride. There are other ways that you can get it. It can be in tablets, but I'm going to talk about that based on some really bad news yesterday morning. Dentists can apply it in the office. Patients can get a prescription if they have particularly aggressive caries to get it at a pharmacy. Okay. It works best in children when it's taken as infants because it gets into the bloodstream. And then when those baby teeth and permanent teeth are developing in the jaws of that child, fluoride gets incorporated into that enamel and it makes it more resistant to developing a cavity I'm not going to go into the cavity process. Just take my word for it. It also works topically. So for adults, for the rest of us, when it enters our bloodstream, it comes out in our saliva, in our mouth, and it bathes the teeth with some topical fluoride in the saliva, and that helps protect the surface of the tooth. There are studies showing harmful effects of fluoride when it is at significantly higher levels than the 0.7 parts per million. There are communities where have a naturally high level of fluoride in their water. It wasn't added, it just occurs there naturally. And those studies are probably accurate, all right? But there's been a lot of criticism of the way those studies were designed, but not at the level of fluoride that we are talking about. Unfortunately, this is not a debate about science anymore. This has become a political issue, and facts don't matter in this discussion. So yesterday, this is, again, true story. I am sitting and talking with a reporter from CBS who wants to do a show on access to care and water fluoridation, both issues. And she says, "Doctor, just 1 second." Across her desk on her computer came across the news that you may have heard about, that the Food and Drug Administration is now proposing to ban all fluoride in any products for children. This is absolute idiocy. This is ludicrous. I mean, what we professionals will say, well, they take that out of water, I can at least prescribe fluoride tablets. That's what your pediatrician would do, or your dentist if you take a child that young to a dentist. But your pediatrician will do that. They're now proposing to take that away. No science, but it's this, science doesn't matter. It's become a political issue. So, I hope you won't be disappointed by the next message. My organization is not going to do anything and is not going to enter this fight. We are laser focused on one issue. We do not have the funding, nor the bandwidth, nor the staff to tackle the community water fluoridation and the other issues that are going to be arising in our state. The Florida Dental Association is taking the lead on that. The dental schools in the state are taking the lead on that. We are not going to touch this issue until we pass dental therapy legislation. So what can you do? You can share your story. If you've got an interesting story, and I've asked Joan to share these slides with all of your members, so you can use the QR code there. We would love for you to join our organization, join our coalition. Hopefully your organization will join, but you as an individual can join, so you can get our advocacy alerts and our updates over the next 9 months or so as we start this advocacy campaign. And either of those two QR codes on the right will get you there. And with that, I am happy to, I'm going to stop sharing, and you can reach out to me if you'd like, send me an email or give me a phone call, and I'm happy to talk about this with individuals.
I do see one question from one of our new board of directors, Ronnie Heller. And she had asked, now that it is against the law in Florida to add fluoride to water, what is the protocol for a 77-year-old woman? Pills? That was the question.
So, the most important protocol is brushing your teeth at least twice a day with a fluoride-containing toothpaste. So all the major brands, except Tom's of Maine, which probably is not a major brand, but it's out there without fluoride. So using a fluoridated toothpaste is the major thing that you can do. Right?
Will we be able to get those products after the law?
So yes, no, there's two stories going on here. So what the FDA is talking about is banning fluoride in products for children, which would not impact toothpaste for us as adults. But I also heard yesterday that Texas is considering an outright ban on any fluoride in any products. Again, this has become part of the culture war. This is not a scientific debate. This is a culture war issue. It's politics. It's the Attorney General Paxton, who you may have heard about for other reasons in Texas. He's the lead on this. I couldn't believe it when I heard it the other day.
Any other questions? I don't see anything else in the chat.
Lisa has a question.
Yeah, I can only read part of the question. I can't see the whole question. Lisa.
It says, even though you stated that your organization is not joining the fight regarding fluoride, the lack of it in the water as of July 1st throughout Florida may actually help your goal of passing dental therapists.
So we are making that argument. You're absolutely correct, Lisa. We are, so the estimates are that over time, this will cause a 25% increase in cavities. All right. This is a cavity issue. This is not a periodontal or gum disease issue. This is a cavity issue. Okay. If we're already strained now, think of how strained we're going to be with a 25% increase in cavities. So we did a survey about, it must be 12, 13 years ago in the county right next to Tallahassee, Gadsden County, a couple of years, 12, 13 years ago. 1 in 5 kids, think about this, 1 in 5 kids was in dental pain. And so my guess is that probably 2 in 5 had cavities, but 1 in 5, it was so bad that they were in pain. Well, if you're in pain, you can't learn. And the way out of poverty is education. So we've just got to do something about this.
It's not supposed to ever be in pain. You never let it get that far.
Well,
the whole idea is to avoid it.
Yeah, right. But when they can't, I mean, the letter I just read to you before when we started the meeting, these people go to hospital emergency rooms because they're in such pain. And again, all they get is antibiotics and pain medication. So they get better relatively quickly, but they still have the problem.
Someone has their phone on. Would you mind?
And Carrie has a question. I think
Hi.
we'll have time for one more question and then we'll wrap it up. Go ahead, Carrie.
Thank you, doctor. What is the salary differential between a dental therapist and a dentist? And is that a problem with passing this?
No, it's not a problem with them. So it all depends on the state. So in Alaska, I want to use that as the best contrast. They're making salaries of $55,000 to $60,000, which in those small remote Alaskan communities puts them at the top of the heap. Okay, what we expect in Florida is for the salaries to be somewhere more than a dental hygienist, somewhat less than a dentist. All right, somewhere in between those two numbers. A dentist would start at an FQHC at about $140,000 a year. A dental hygienist is going to be $60,000 to $80,000 a year. So we figure somewhere in there. So it becomes a great career growth opportunity for somebody. And the reason we want to put these in state colleges, because we want to get those kids to go to state colleges. We don't want the kids who can go to the University of Florida. We want the local, first and family in college, people of color, rural community folks. Why? Because they're most likely to go back to those rural communities as an example and practice. That's what we're seeing in other states.
Okay.
Thank you.
Any other questions?
Thank you.
I don't see anything more in the chat. Suzette, would you like to wrap it up?
Absolutely. Thank you. Before we close, I want to take a moment to extend our deepest thanks to Dr. Frank Catalanotto for joining us today. Your slides were engaging. I felt as if I was back in college. They were excellent. And your insights, expertise, and advocacy are not only informative, but truly inspiring. We're so grateful you took the time to be with us to share your work. And we hope that you
Thank you
Yeah.
very much. I appreciate the opportunity.
Thank you.
Join.
And of
We
course,
need your support.
we'll have the QR code for our members, participants, if they want to join. A big thank you as well to our Healthcare Committee co-chairs, Joan Sternberg, Linda Bloomfield. I didn't see her, but thank you to her as well for your ongoing leadership, dedication, and vision. The work you are doing is really making an impact, and we're proud to have such passionate leaders leading the way. And thank you to all of you for showing up today, whether you spoke, listened, answered questions, or just took it all in. Your presence matters. And maybe the next time you say to someone, I love your smile, you can ask, have you been seeing a dental therapist? And spread the information you learned here today about dental therapists and dental health. So let's keep the momentum going. Join a committee, invite a friend, donate if you can, and most importantly, stay engaged. Thank you all and have a good night.
Thank you. Thank you very much. Good night, everybody.